Hi, I'm Dr. Giavonne Rondo with another episode of Healthy Mind, Body, and Spirit. We're in season 3 and we're doing episode 4, part 2. We had to bring her back. Dr. Marlyce Hill Ali has brought us some great information in regards to health literacy and telemedicine. We couldn't get through all the questions, all the things that we were talking about, so we decided to go ahead and bring her back again. So thanks for coming back,
Thanks
Dr.
for
Hill
having
Ali.
me back. It's a pleasure.
Yeah, this has been great.
Yes.
So we just want to kind of revisit just the whole concept of health literacy. It is so important.
Yes.
Mightily important to just, everyone.
Yes,
but
especially nowadays.
But particularly during this time and for our community.
Exactly.
So just go over again what health literacy is all about and why it's so important for our community.
So health literacy has to do with how much you know about your chronic diseases that you have so that you can make decisions, right, that help to not worsen your chronic diseases or even improve it. So an example is someone who has diabetes, understanding that you can't go to Krispy Kreme when the red light is on as much as you want to, right?
Like I did the other day?
Exactly, we all do that.
Literally.
Right, if you do, you got to get the little bitty tiny one, so you can only have one, right? So that you don't drive your, blood sugar up and then increase your risk for all the complications from diabetes. So it's not just about knowing what you have and knowing what medications you need to take. It's also knowing what kind of lifestyle changes you need to make in order to help yourself succeed in managing your chronic conditions.
Okay. So yeah, it really is all about, or a big portion of it is lifestyle when it comes to our health.
Yes.
So absolutely.
Yes, everything is.
So you talk about specifically diabetes, but there's other disease states that are, plethora of disease states that, being health conscious or health literate is very important. Could you go over those?
Sure, I think the big three, I always think of the big three, right? Heart disease, COPD, right? Diabetes, right?
Okay.
Because heart disease has a whole spectrum, so you can start with people who have hypertension, right, which can progress to overt organic heart disease, right? MI, heart attack, CHF. So you go from the spectrum of having high blood pressure where your doctor's saying to you, you need to get your stress under control. You need to watch your intake of salt, fried fatty foods, eat more green leafy foods, change to a more Mediterranean diet, right? So that you can get your blood pressure under control and take your medicine. And then when you're out, make sure you're not drinking a bunch of beer with a bunch of salt or a bunch of soda with a bunch of salt or buying a bunch of soups off the, shelf with a bunch of salt. That's the kind of feedback you give, and then you realize, life is difficult, right? Making these absolute good decisions can be challenging, but that's where the partnership and the conversation between patient and doctor comes in, right? So it's the same thing with CHF. You have to watch by that time not just your salt, but your water, your fluid intake, right?
And when you say, when you say CHF, congestive heart failure,
yes, I forget. I'm sorry.
No.
I'm talking to another doctor. So
We have so many acronyms for different things and shortcuts. But we have to make sure that everyone is very
to everyone. Exactly.
Absolutely.
So congestive heart failure, you have to watch, your fluid intake, your salt intake. You have to watch the types of food that you eat. You have to take your medicine diligently, and you have to make sure you're in close communication with your doctor. I tell people all the time, make sure you weigh yourself daily. That is the quickest, most reliable way of determining when you have congestive heart failure whether or not you've taken on too much fluid, right? Okay. And if there's a change in that weight, something you and your doctor negotiate, whatever that change from baseline is, then you need to reach out to your doctor and say, hey, is this something, I should be concerned about? So, COPD is the same thing. We know that in Kentucky, tobacco has been a cash crop, right? We've struggled with ways of controlling tobacco cessation and implementing it in a society. We were 20 years behind the rest of the country in enacting tobacco bans in public places, right?
Is it because of the, how much we use.
I'm sure. And you know, when you think about
economically,
the economics, right? You know, if you have a farmer and that's their only crop, you know, it's sort of hard to negotiate that. Those are all politics. That's why I'm a doctor, right? But in the grand scheme of things, we know that tobacco is one of the biggest preventable health catastrophes that this country, this world has ever seen.
Absolutely.
COPD, even heart disease.
Absolutely.
And I remember learning the contribution that tobacco has on the development of diabetes with the endovascular dysfunction, right?
Absolutely. Wow. So knowledge.
Exactly.
Yes,
so if you think about this, you know, you said it earlier, lifestyle modifications are key. So abstaining from tobacco, eating a balanced diet that looks colorful like the rainbow, right? And getting your body moving through physical activity. I tell people, you don't have to just start out like you're training for the Boston Marathon. Just getting yourself moving a little bit every day and changing your diet can create healthy lifestyles that can help you, you know, contain your chronic diseases. I don't think people understand that enough.
Absolutely. And so that's what this is all about, being more literate, you know, and being able to sit down and talk with your physician, talk with your doctor about those issues and how that, you know, pertains to each individual person. Now, you mentioned COPD, so we have to break that down into exactly what COPD actually means.
COPD is chronic obstructive pulmonary disease. It is the sort of obstructive lung disease one can get after years of smoking tobacco. And I think the estimates are something like 7 years after you take your first draw on a cigarette, you're set up for COPD. Maybe
if
not
you continue.
Even not even if you continue.
Oh, really?
If you just take that one cigarette and you have that one cigarette, that's how sensitive the lung tissue is, and that's how insidious tobacco is. Now that blew my mind, but you know, these are the types of things, you know, our lungs were not meant to inhale, you know, burning gases.
Wow.
Because they're very sensitive.
See how important health literacy really is? She's teaching me. And I, you know, thank you.
Yeah, absolutely.
This is such a vitally important topic.
Yes.
So when someone actually sits down and talks with their doctor, what are some of the things that they need to be discussing with their doctor? You know, we've talked a little bit about just some of the disease states, but what are some of the other things that are important for people to actually do when they're sitting and talking with their physician?
One of the basic things that people can do that will lead to improvement of health literacy straight off the bat at their next doctor's appointment is to sit down, bring all their medicines, sit down and say, what is this for? Don't just tell me it's for high blood pressure. How does this work? Is there anything that I could be doing that could be interfering in this, right? Just creating that conversation. In the, you know, this in healthcare, physicians, nurse practitioners are extremely busy. They come in, they're trying to get everything done in 7 minutes, right? And then they're trying to go on, but
probably about 5 minutes. 5 minutes,
right?
It feels like it's 5 minutes.
It feels like it because there's a lot to do in a short period of time. But if patients come in focused and say, hey, this is what I want to do, it actually can lead the clinician to say, okay, let me change how I approach this appointment and make it more impactful for the patient. So that's the easiest thing. Take what you're taking and say, what is this? I know the condition I'm taking it for, but why this particular medicine? Is there anything I should be worried about? And they'll come out of there with way more information than they had before.
So really utilizing that time that they spend with their physician in a way that where they're questioning, where they're trying to extract that information, you know, from the actual clinician or, you know, nurse practitioner or the physician, I should say. So wow, that's great. But what if they have a whole boatload of medicines? You know, is that something that can really be done within, you know, 5 to 10 minutes or?
Well, the way you do that, you can group the medicines into the categories for the conditions, right? So I'd say, okay, Ms. Smith, these are all your diabetes medicines. So we're going to talk about those today. Okay. And then I'm going to make you an appointment to come back in, let's say, 2 to 4 weeks for another medication education, right? And then we'll talk about your heart medications or your lung medications. And then that way you sort of, without knowing it, you develop a curriculum for health literacy for them,
look
right?
At that, yeah.
And you say, okay, today we're focusing on diabetes. And people don't realize that, medication education, that is a billable service. I know a lot of times clinicians say, well, I don't have time to do this. You can actually create a billable appointment that says you can sit down with your physician and your patients, and clinician can sit down with the patients and say, this is what you're taking, this is why. Are you having any of these side effects? Are you having any of these adverse reactions? And go through and really march through the medication. I think that most people don't think about doing it because we aren't taught what can be billed or coded for.
Right,
we don't. We're taught disease states, how to treat it, what's used. We aren't really taught the business of medicine. And so a lot of times we feel like our hands are tied. But you can create that. And doctors and clinicians and nurses, they won't know to do it if the patient doesn't come in and ask for it. So that's why I say come in with a conversation like, hey, I want to learn more about this. Your doctor can create those health literacy appointments.
That is awesome.
Absolutely. Case management too. Even if if your office happens to have a case or a care manager, you can say to them, I'm going to teach you this, but I'm going to hand you off to my care manager for more intense education around this, because I think it may benefit you. And then you can hand them off to a care management. And care management is actually kind of new in the primary care setting, right? Where you're used to it in the hospital setting, right? Where you're transitioning people from inpatient to outpatient. But in the primary care setting, there's a real role for care management.
So these are people who actually come in, and they have that title, care management, or are they social workers?
Well, they can be a little bit. They can be a little bit of both. So they're care managers, which usually means that they are case managers. They're RNs that have case management experience and education and advanced training, and they understand how to do care coordination. And they can do transitions of care, which is where you're really getting people set up for a successful discharge. Right after they're in the hospital, you say, okay, Ms. Smith needs to go to a skilled nursing facility. I'm going to set that up. I'm going to contact that person's primary care doctor, let them know what's going on, and send it to the insurance company, that kind of thing. Or you have some that are involved in, chronic disease education, where they go in, they roll up their sleeves, they say, hey, your doctor tells me you have diabetes. Let's talk about that. What do you know? They assess, they do an assessment, figure out where the patient is, and then they say, okay, listen, I think if we meet once a month, I think in 3 months you'll feel so much better about the choices that you're making. And this is something that is fairly new. In fee for service, they would have to refer to a care management or case management service for this. But in Medicare Advantage, a lot of the Medicare Advantage care coordination involves the care and case managers that are right there. And so these Medicare Advantage doctors just hand it off to someone in the office and say, hey, can you educate this person, and it improves health literacy.
Wow, that is amazing. So it's not just the doctor going in and trying to do, you're talking exactly what I was going to say. The team approach is really, really important to, really getting that health literacy.
Absolutely. In the same way with, when you look at this, social workers are absolutely involved, because how many times have you, heard from a nurse, hey, my patient didn't have this enough money for this. Well, then the social worker can figure out where can we find the resources needed to provide the medication or the resources needed so that this patient can stay healthy.
Wow, that is awesome. So I do remember a couple of times actually having patients who come in who could not read, or who just really had a lot of difficulty with just even understanding, their medications, and so. Really having those resources like social workers, like people who could kind of key them into exactly how they could get more information, and something as basic as knowing how to read. It's like, okay, so how do I get that information? How do I, even give them, point them in the right direction. So I think that that's great you're absolutely right about having care management on board with any kind of office.
Absolutely.
So so that's one topic that we wanted to talk about in terms of health literacy, but also you're really big in terms of telemedicine and telehealth. Can you kind of revisit that also?
Absolutely. So telehealth, as I said before, is sort of the broader umbrella where things are being done via telecommunication, whether it be non-clinical or clinical interactions and appointments, okay? And so just going back to the care and case management situation in improving health literacy, telehealth is an excellent way to reach out to patients and help them learn more about their chronic diseases, right? So it's not just telephone, it can be video, it can even be Zoom or WebEx, right? Because we've gotten very sophisticated over the past few years with how we communicate via telecommunications. So,
and speaking of telecommunications, we just have to take just a really quick break here on Healthy Mind, Body, and Spirit. We'll be right back. Hi, Dr. Giavonne Rondo with Healthy Mind, Body, and Spirit. Please join us for the next episode of Healthy Mind, Body, and Spirit with Dr. Mark Jurich talking about addiction, specifically in our community. Come join us for the next episode of Healthy Mind, Body, and Spirit. Welcome back to Healthy Mind, Body, and Spirit. We're talking with Dr. Marlyce Hill Ali, and now we're on the topic of telemedicine. This is something that has just exploded during this pandemic, so we're going to talk a little bit more about it. Of course, we've mentioned what it is. We also want to talk about how it's expanding in our whole world, how we in the African American community can utilize it most optimally, and then the tools and the equipment that we can use for that. So I'll let you go ahead and talk about telemedicine.
Absolutely. So before COVID, there was still a debate as to whether or not telemedicine was a valid way to see patients, right?
Yes.
And I'm not going to say I feel vindicated, but I absolutely feel vindicated.
Absolutely.
I've been screaming this since I was a resident, right, and debating people about this. But
you're just a very forward-thinking kind of person, obviously.
I think so, but I think it just felt like the right next step, you know, because there's always the challenge of how do you educate people? How do I reach my patients in between appointments and really see what's going on? And that curiosity has started this whole literature search. So as we get to the COVID situation, as it exploded, you really only see the entities and the facilities and the institutions that had telemedicine and were capable of pivoting. Those are the ones who were capable of driving growth, right?
Yes.
And so there was a debate, right? Well, I don't really know what's going on. I can't really see the patient. You can see the patient. Well, we're not really sure. It's an absolutely valid way to perform a non-acute visit for chronic diseases, right? So no, you can't manage seizure, heart attack, you know, stroke in the community that way, right? I know that they do in the hospitals with the robots, and those are very controlled situations, and they're between facilities, right? But you can absolutely see someone and talk to them and monitor what's going on with their blood pressure, their diabetes, their COPD. So there's a lot of different monitors, telemedicine monitors and toys out there, right? They can check your blood pressure, it goes right to your doctor. They can check your heart rate, it goes right to your doctor.
And all this is virtual.
All this is virtual.
Wow.
Right? And these are, I call them patient packs. So you can send these patients these packs that sort of they you know, hook themselves up to the equipment, and the information can go directly to their doctor, so they get all of the vital signs, and they can have a real-time appointment with them with vital signs. And there was like, well, how do you do a physical examination, Dr. Ali? Well, you have a camera. You can
have them open their mouth.
You can guide them.
Look in their eyes,
One of our colleagues at the University of Louisville, Dr. Giavonne Trice, has developed a Bluetooth stethoscope.
Wow.
Okay.
All right,
so
Dr. Trice.
Yes, Dr. Trice. So you can put this wherever.
And isn't Dr. Trice from Louisville?
He is.
Oh, my goodness.
He is a University of Louisville alum as well.
Awesome.
Right. So there are so many different toys out there now where you can actually get real-time data and real-time interaction. Okay.
And I'm sorry, so this is beyond just wearing
beyond the Fitbit,
it's or the smartwatches and things like that.
It's beyond that. And people are like, well, how do you do that? You can deploy it either just by giving your patient a pack. You can come up with a pack. There's Welsh Island has them. So many different people have these, right? Or you can send an MA out and say, hey, hook this patient up. I'm in the center or I'm in the hospital. and let's see what's going on. So there are so many different ways to deliver telemedicine, right? But basically, the minimum equipment you need is a smartphone.
Okay.
That's the minimum equipment.
Wow.
Okay.
So you don't need a lot of big kind of things coming into your home.
Things.
So just a smartphone, and you can get a lot out of that.
Exactly. And
wow.
I used to tease my patients all the time. I'm like, if you can play Candy Crush, then you can tap the app to call me when you get sick, right? So it's the same concept.
I like that.
It's the exact same concept. So don't tell me you went to the ER because you didn't know when you could have tapped the app and got me. So that's the minimum criteria, because you have voice, you have the Zooms and the WebExes on there, and you have video chat and video conferencing capability with most phones. That's the minimum amount. And so a doctor can have a conversation and capture that, document that, and actually bill for that.
Okay. Internet access.
Internet access may or may not be needed. You can have a telephone or a video conferencing discussion with a provider just using your cellular service, right? If you want to use Zoom or WebEx, then you would need, an internet access or web Wi-Fi access.
Right. So that doesn't mean, so the communication can still be there.
Yes.
Even if you don't have internet, you can still have, certain things that can be done. Wow.
Telemedicine can be done on the Obama phones. Okay.
Wow.
It can be done on the Obama
phones.
You know how they call them that, right? It's just a number. And I know there's a lot of, preconceived, notions about what this is, but it's an actual valid encounter with your provider. And it's a way to increase access for patients to their providers beyond the my charts and that kind of thing.
Yeah, and meet people exactly where they are.
Exactly.
Yes.
Exactly. Because most people, especially in behavioral health, my husband's a psychiatrist, right? What we saw in behavioral health was staggering. We found people more compliant during the pandemic, right? We were first thinking maybe it's because of the diagnoses. No, they didn't have the stigma of going into the behavioral health facility, right? They could do it at home and have that interaction.
So when you say behavioral health, you're talking about mental issues like things like depression and anxiety. Yes. So they were actually doing better.
They were doing better and more compliant with the telemedicine appointments than they were pre-pandemic when they had to come into the office.
That's amazing.
Yeah.
Absolutely amazing. Yeah. So speaking of this also, what about the future? What does the future look like to you, since you tend to see things in a very forward kind of way? What do you see in terms of with not only telehealth and telemedicine, but also health literacy overall?
Yes. I see telehealth as an absolute vehicle for improving health literacy and just the overall healthcare quality. I think the old way of talking to a clinician on call is gone. We no longer have an excuse not to leverage telemedicine for someone in the middle of the night, right? If they have the smartphone and they can interact. And I challenge clinicians to do that. It's no longer a matter of whether or not it's going to be billable. It's billable, right? It's not that you won't be compensated for the work that you've put in. What you do with the telemedicine, you expand the services, you expand the reach to your patient. It's no longer, you're having that go to the ER. No, you're like, listen, turn on your video, let me see what's going on with you. Or better yet, if you're on the phone with them and you give them a plan of care, like, okay, I hear you're short of breath, let's increase your albuterol, your apotropium, take your azithromycin pack you have, come in and see me in the morning. We can effectively leverage telemedicine to keep people from going into the hospital who don't need to go.
And save a lot of time. And money.
Well, and bad things happen to people who go into the hospital that don't need to go into the hospital, right? And I tell people all the time, medical error is a real thing.
It is.
The aviation industry understands this perfectly, right? Which is why they have all of the safety mechanisms and processes that go along with aviation. Healthcare is getting there. And in value-based care and managed care, because everything falls underneath the umbrella of the per member per month payment, you get really creative at the processes and the risk mitigation you create to make sure that you are taking as good a care of your patients as possible, because that's what you signed up to do, right?
Wow, just so much great information. That is just really wonderful. So in terms of how you use telemedicine, both as a clinician, as a physician, but also as a patient, could you elaborate on that, how you utilize that?
Yeah, so as a physician, the way that we've been using it, of course, is for a variety of things. Regular follow-up appointments for stable conditions, urgent appointments, say the sinusitis and, allergic rhinitis, earaches, those otitis kind of things. Or you use it for post-discharge follow-up. You have someone who's, been in the hospital, they get out, they get a whole new list of medication.
You have to do
that
the medication
needs to be reconciled,
yes,
right?
Yes.
The physician needs to know what happened. Yeah, they have the hospital record, but you want to talk to the patient, see what led to the admission. All of those different appointments can be managed and can be, telemedicine can be leveraged to, complete those appointments in a timely manner, in a less invasive manner, right? Because post-discharge, how many people want to come out of the house?
Come right back out, yeah.
And I tell people all the time, it's so simple. It's just as simple as leveraging that. And people are like, well, what if we need vitals? Then that's what you send your MA out for, or you call your home health agency that's probably out there and say, hey, can you send me the last set of vitals? Or can we coordinate the appointment? I'm going to have it here. Can you guys be out here? Home health agencies are so underrated. They're very accommodating. You call, they just want someone to work with them. And I've never had a home health agency tell me, no, Dr. Ali, we absolutely can't do that. They want to have that interaction. They don't like don't like sending patients out to the hospital. They want to be able to care for them in the home. And if they know they have a provider that wants to partner to take care of their patients, they will remember you, forever and call you on all your patients.
So you can have home health come out. You can have your medical assistant go out and actually do those vitals, and then you can also send them with a certain amount of equipment, out of the from the hospital. Okay.
Exactly.
So, but you still would not utilize obviously something like this for emergencies.
No.
For like an accident or seizures or stroke.
Yeah. Or the worst headache of my life. All those kinds of things. Yeah, all those things. When you hear those buzzwords that let you know it's acute, you send them straight to the ER.
Okay. Okay. Wow. We still have a few questions to answer, but we are just amazed by just the information that we've been able to gather today to make our community more literate overall. And then when we become more literate, we're going to become healthier, just as a community. So thank you so much for teaching our community more about what telemedicine, telehealth is all about, and what health literacy and how important it really is. Thank you so much again for this is our first time ever doing a part 2. It was just so it's so vitally important, and we thank you so much. You've been a wonderful guest, and we just appreciate you. So thank you for coming on the Healthy Mind, Body, and Spirit show, where we focus on benefiting our entire community by giving information like what Dr. Hill Ali has given us today to make us better. Thank you.
My pleasure.
Thank you for joining us, and be well.